How do brain regions determine different seizure types? Imagine your brain as a busy city with many neighborhoods, each responsible for different tasks like movement, sensation, memory, or emotions. When electrical signals in one neighborhood start to go haywire, it can cause a seizure. But the type of seizure you experience depends on exactly where in this city the abnormal activity begins and how it spreads. Seizures are mainly classified into two big groups based on where they start. The first is called focal or partial seizures. These happen when abnormal electrical activity begins in a specific part of one side of the brain. For example, if the activity starts in the motor cortex, which controls movement, it might cause twitching or jerking in a particular limb. If it begins in sensory areas, you might feel strange sensations like tingling or see flashing lights. When seizures start in the temporal lobe, they often involve emotions, memory issues, or even a sense of déjà vu. The symptoms during these seizures reflected what that particular brain region does. Sometimes, focal seizures stay limited to one area, but they can also spread to involve larger parts of the brain. When they do, they might cause more widespread symptoms like loss of awareness or convulsions, which are called focal to bilateral seizures. The second main group is called generalized seizures. These involve abnormal electrical activity that starts in both sides of the brain at the same time. Because of this, they tend to produce more widespread symptoms like full-body convulsions, sudden loss of consciousness, or staring spells called absences. And like focal seizures, generalized seizures do not begin in one specific spot but affect the entire brain from the start. The way a seizure looks and how it affects consciousness depends on which brain regions are involved and how the abnormal activity spreads. Modern classification systems, like the one from the International League Against Epilepsy, focus on describing seizures based on where they start and their features, including whether consciousness is affected and what kind of movements or sensations are involved. In the context of brain health and tumors, seizures are a common symptom because tumors can disrupt normal electrical activity in the brain. The location of the tumor plays a big role in what kind of seizure someone might have. For instance, a tumor in the temporal lobe might cause focal seizures with impaired awareness, while tumors affecting larger areas or multiple regions can lead to more generalized seizures. Understanding which part of the brain is involved helps doctors figure out the best way to diagnose and treat seizures. Tools like electroencephalograms, magnetic resonance imaging scans, and careful observation of symptoms help identify where the abnormal activity begins and how it spreads. This knowledge guides treatment decisions and helps predict how the condition might progress. In summary, different seizure types happen because abnormal electrical signals start in different parts of the brain. Each brain region has specific functions, so the symptoms reflected those functions. Recognizing where seizures originate is key to managing them effectively, especially when brain tumors are involved. If you or someone you know experiences seizures, it's important to consult a healthcare professional for proper diagnosis and personalized care.